Hello, I'm here with a health illness update, which, as usual, I'm not feeling as prepared for as I thought I might be. I think this is update 17. Barely Bear's been through a lot and just recently got his fall risk notification bracelet, I suppose we call it. It went around his neck. Still has his limb alert on the damaged limb, and recently got a vaccination there. Well, I suppose we're supposed to be doing a health illness update on me. So the last one was the start of July. So I'm guessing that was around July 5th when I had an appointment with the oncologist. So I just have right here my calendar. So I'm going to just scroll through and see which medical things show up, and then talk us all through them as best as I can remember. So July 25th was my next appointment. Oh, okay. So that was with the pulmonologist, Dr. Corwin in Guilford, and they, I had an exam, and I don't know what you call it, a visit, an office visit. So we talked quite a bit, and there was no cough at that point, and I think I got the impression there that she wasn't sure why she was seeing me. In other words, she had addressed whatever my issues were, and successfully, which is also how I felt. And I can't remember now, either we didn't schedule to see her again, or it was one of those, I'll see you in 6 months, or I'll see you in a year, but everything's fine kind of a things. So it left me feeling good, both to be in her presence, to have the talk back and forth, obviously to get what felt like good news. And so I'm on my way. That Friday, the 28th, I had an appointment with my GI colonoscopy doctor, I guess, who's Christopher Illick in Brantford. And I got to, the way it worked out is I saw his PA, Laura Striffler, who I hadn't yet seen, and I thought she was fantastic. And I remember so far thinking everybody in that office is fantastic. And I think the idea was that I'd be having the colonoscopy on August 9th. And so they wanted to prep me for the prep. And also because of my particular conditions, I guess I'm a non-normal colonoscopy patient. It's not just seeing if there's anything wrong. It's kind of seeing, how things are that are not right. Anyway, she put me at ease. I easily answered all my questions, didn't feel rushed, helped me feel comfortable with the understanding of what's coming up, which seemed to me just to be like a ordinary colonoscopy. Like it seemed very similar to, or exactly the same as the consultation I did with Dr. Illick before my colonoscopy that was about a year ago, which kind of revealed this whole thing and strapped me into the roller coaster of healthcare. So anyway, altogether, quite a positive experience. On August 1st, I had a blood draw for Natera. That's the ctDNA test. And I'm gonna see if I can look that up in my notes here too. So the ctDNA test, and this was my third, the one that was August 1st. The idea is that since they have the tissues or tissue sample, I suppose, from my actual tumors. They create an assay or a sort of a filter, if you like. They have a very fine understanding of my particular cancer, not my particular type, but my actual the specific DNA of mine, which probably only very minusculely, like that word, varies from other cancers of the sort. But at any rate, that very, very detailed understanding of what it is I have allows them to have a very, very detailed or specific view into my blood and basically know what they're looking for. So when they do the blood test, after they've created this kind of filter, they can say, all right, we know exactly what we're looking for in you, and we should be able to tell you if we see any, or if we see enough, to intervene or whatever. And so I've had 2 of those. August 1st was the 3rd, and for whatever reason, the way the company works is they send somebody to me to draw the blood. Before that, they send me a little kit. I get that, confirm I got it. Then they schedule the phlebotomist. The phlebotomist comes, draws the blood, into the kit, and then FedExes the kit that morning to, I think, California. And then I wait, and that's the idea. On the 4th of, this was got to be August, right? I got to do a follow-up with my my APRN at Dr. Rubenstein's office. Her name's Cotter, Cassandra Cotter. And at this moment, I'm trying to remember if, I'm just trying to remember if, what I was there for at that moment. Sorry to be kind of delaying you as I just try and remember. I feel like this was my complaining of the cough and such. So let me just kind of think this through. We're looking at, because that was the sick visit. So so that follow-up, I think, was just to kind of the overall check-in in terms of the cancer situation. And I remember it as being very good because every session with Cassandra has been, brilliant and perfect and lengthy and unhurried and informative and welcoming and generous and empathetic and attentive. So I think this was just a follow-up in which, we're just kind of looking at everything, anything that's missed. And I was also talking about my Hep B vaccination at that point, thinking, look, everything kind of seems like we're in pretty good shape, and this is a vaccination that I've missed. So maybe we can kind of start to think about getting that done. I think that there was some confusion about whether or not I had it. So I think this is the visit at which she ordered a blood test to look for evidence of my having had the Hep B vaccine. So I think that's what happened there. Okay, so then we skip ahead to August 9th when I had the colonoscopy. What you may remember, this is just about a year, maybe 11 months or something like that, since my prior colonoscopy. The small and large intestine kind of end in a little sort of a question mark kind of a shape, a sigma kind of a shape, a tighter curl, right at the end of the whole canal. And that's where they found the cancer. So when I had my earlier colonoscopy a year ago, that's actually as far as they went. They weren't able to proceed past the cancer, the tumor, whatever the best term there is. And so I actually never had a complete one. they kind of said, nope, okay, there's a problem, and that's where we were. So I had the colonoscopy, and clearly you're looking at me now. A month later, I woke up, and everybody was very kind, and they informed me that they were able to complete it. That was good. They were able to tell me that, as I'm recalling now, they didn't see anything of concern that they had to take out. Like, I guess they normally will see polyps and stuff, and they're like, let's go send some of these to the lab, that sort of thing. So that was good. I think the next day I got to read the full report. And one question I had for them is that, I know that they've taken part of my colon out, or as I prefer to think, being such a positive person, rather than having taken it out, I prefer to think that they installed a semicolon. That's my preference. And I was just kind of wondering, like, well, I'm imagining you're going past the point at which the surgery was to look at everything else. And I was kind of wondering, like, are you going to take a look at the site of the surgery from the inside since you're passing? And I was kind of thinking, maybe that's not their remit. And maybe they don't take any extra time there, or have the skill to look. I don't know. So I remember I had asked that for Jennifer Striffler, and she said, yeah, they likely would. And then when I was able to read the report and actually talk to Dr. Barshop, who's the colonoscopy doctor, immediately after, the propofol, he said they did get a look at the site of the surgery from the inside, and everything looked great. So I thought, that's nice, because maybe you don't always get to see the other side of a surgery. And so that was good. And I also think, like, just in general, they didn't see anything else wrong. Like, basically normal results. Maybe I'm a bit of an abnormal case, having had the resection, but still, just overall, we don't have. We'll see you, I think, in 2 years. I think is the maybe in my case it's every year. I don't really know, but basically. All good. On the 12th of August, I went up to New Hampshire to teach, so that I was able to travel and move, and that was great to see some great folks out of that way. So where we're towards the end of August. Basically, I have things color coded here in my calendar, so I'm just looking for yellow, and presuming I don't miss anything. So September 1st was my next visit. So this starts a whole new kind of situation, I guess. So basically, July 31st, I started having other symptoms, or another symptom set, maybe we could say, which I'll talk you through now. That was July 31st, and by the time I got to September 1st, obviously a little bit before that to make the appointment, but basically all of August, I was feeling this this set of symptoms, and so I had my first visit with my regular GP, Dr. Rubenstein, on September 1st. So I'll talk about that, but we'll go through the symptoms a little bit too. So I had the return of this persistent, unproductive cough on July 31st, about 9:30 in the morning, as a matter of fact. And the cough that I had previous, if I was just observing the cough all by its lonesome, sort of in isolation, I would say that it is exactly the same cough as I had had, and as I had addressed and resolved with the help of the pulmonologist, Dr. Corwin. And basically the resolution there is that well, it's not asthma, it's not something in your lungs, it's not, I don't know, a virus, it's not postnasal drip, it's not, it has to be coming from the GI, from below. In other words, GERD, gastroesophageal reflux, and which I wasn't feeling at all. But she said sometimes people don't feel it, but it's happening, and then the cough is kind of, the body's reaction to that. So she put me on PPI, and so I started taking that, and that kind of made the cough go away. I forget when, but you could review prior videos, but it went away for, I guess, a few months. I don't know. So basically, in my mind, that's just a past tense thing. And of course, I had seen Dr. Corwin just something like a week before the cough returned, where we had both decided, like, oh, I think this is kind of a past tense issue. You're not going to really need to see me too much. I haven't seen her yet since then, but my expectation currently on September 20th today is that I'll probably be seeing her next. So anyway, the cough is unproductive. It's annoying. It gives me a headache, but not a fever, but a headache from the sort of the coughing. And sometimes I'll have, probably every day somewhere, I'll have a coughing fit where it's really not just, sort of that kind of cough, but I need a minute here to, really cough, and there's no productivity. Seems to be aggravated by oral fluids, but it doesn't matter if it's hot or cold. The cough isn't different times a day. Anyway, but there's sort of like a suite of symptoms that showed up, which seems so far to have puzzled everybody. And I say puzzled them because there's no sort of unifying diagnosis available to anybody. But it could be that, well, I have this set of symptoms, but these two are from this issue and these are from that issue. They could all have to do with the cancer, I suppose. But to me, if somebody was saying, how are you in terms of the cancer? I'd feel like, well, I think I'm as good as I could be. By the way, that ctDNA test eventually, which is a whole other story, but came back no evidence of disease, and that was the third in a row like that. And I don't feel like I've had any complications in terms of, sort of the bowel or the liver. So, just strictly thinking in perhaps a narrow way about sort of the cancer or the post-cancer interventions, how am I doing? I feel like, I'm doing better than anybody's ever done. That's how I feel. I don't know how well other people do. So that's why I say it's how I feel. I don't know what's true. I'm currently thinking of this new suite of symptoms as just this other issue, this other problem I have, I don't know, virus, infection, illness, disease. I just don't know. Nobody knows yet. But maybe it has to do with the cancer, and it's all part and parcel. As I film this, I just don't know. So I've decided to consider it its own issue in terms of how I'm considering it now. At any rate, so we have the unproductive cough, and then I began to develop this sort of neck, shoulder, upper arm, posterior, so not like the upper chest or throat or collarbone area, like a soreness, weakness, tenderness. I'd say probably, yeah, it kind of like sore as if I'd really worked out. But, I know that that's not the case. Not that I didn't work out, but I think I know my body quite well and listen very well. And, the first time I noticed it, I was like, oh, what did I do yesterday? Was I pushing hands with sumo wrestlers? No, no, no. Did I do the plank for 3 hours? No. Did I, just kind of, because it felt just like, okay, I'm just sore after workout. But there had been no such workout that, would have made me that sore. So I also felt kind of tender, kind of weak in that area. And that persisted for quite a long time. Um, the third, I would say, primary symptom, and this is just me guessing what's primary. Doctor might say, well, that other little thing you just mentioned is actually, primary. I don't know, but I think of it as the cough, the sort of weakness, and then cold sweats. Most often overnight and or early morning, but sometimes during the day. Enough that I want to change the sheets, or if I have a shirt on when I go to bed, I want to change that. And so just my whole body is wet. And it's uncomfortable and annoying, but it doesn't feel like the end of the world. It suggests to me some kind of infection, but no fever, and no fever throughout. I've checked constantly, so no fever and the sweats. I also noticed that I had parts of my body that were kind of warm, like the low to mid back, around the hips, the upper arms. I don't know if that's like an important thing or not, but so this was kind of August, about the start of September, so that's about 3 weeks ago now. I noticed I had less soreness, weakness, tenderness in the upper back and neck, but it still persisted. Just updating my notes on. And then that sort of change in symptoms or symptom intensity also came along with looser stools, more GI distress. I don't know how much you guys want to know, but the stools have been looser than they've ever been since the surgery, but not terribly loose. And I've mentioned this at every opportunity, and nobody seems particularly concerned, including me. And the GI distress is really just about a little bit of urgency or a little sense of pressure, but nothing that, nothing really complicates a BM or anything. But I also ended up with that weakness, soreness kind of thing in the left wrist area, which seemed kind of interesting. And around this time, that we're talking the start of September, that the cold sweats, if that's the right term for it, were less intense. From the start, they've always been inconsistent, so they're not every day. I would say they're probably about every other day. 3 to 4 times a week would be my guess, but it could be a couple times in one of the days that I have them. In fact, I will update that. Let me just update this here. Okay, there we go. Thank you for accommodating that for a moment. Okay, so then about September 10th to 13th-ish, so that would have been, a week and a half, 2 weeks ago. I noticed the weakness in the shoulders and neck is largely gone. Good. Still have that neck strain. It actually kind of, it's like a mohawk where the headache part comes, and maybe I can do it sort of like this, but it's kind of like here, and that line, which you can't see now, but if we were to just continue it, down towards the base of the neck, that's very consistent with where the neck strain is. So just like right here here in the neck, and then the headache kind of just matches it. So it feels like this offset kind of mohawk of the headache kind of zone, and then the neck strain. Maybe they're related. I don't know. And then the stools became looser. I also noticed that the neuropathies that I still experience since the chemotherapy, the oxaliplatin, the platinum in the oxaliplatin being the blamed factor. I feel like I have like what I've described as a decrease in my accommodation of those neuropathies. In other words, I feel like I suffer them less well, or there is an increase of the neuropathic symptoms intensity. So it feels to me like they're more intense. But I also recognize that it could be, well, okay, my tolerance is decreased. And, I feel like, well, either could be true and I wouldn't know the difference. So it's hard for me to feel like I can objectively report that. Soon after that, the stools returned to solid, but then they were followed by actual diarrhea for a couple of days. Then that recovered from that, like you would normally expect, like if you ate something poorly. But I'm almost certain I didn't. I didn't have any other, food poisoning kind of effects. And I would say in the last couple of days, I don't feel any weakness in the upper back or neck. That soreness, weakness. Okay. So during this period, I think before I went in to see the doctor for the sick visit, which was the start of September, I did at-home COVID, negative, 2 times over, I think it's 48 hours. Somewhere in there, and I didn't mention when, I didn't see it in the calendar, but I got my first dose of my Hep B, and the Hep B can have some side effects that are a bit delayed. So I kind of reported that just to make sure people are thinking about that. Maybe some of what's going on is that. I don't know what the odds are or anything. But nobody seemed to glom onto that and say, oh yeah, that's, that's definitely to blame here. So I don't know. So I've already missed my second dose of Hep B, and they're supposed to be in a schedule. Like you have one, and then 2 weeks later, and then I think 2 months later you have your third and last, something like that. But I missed the second. Nobody seems to be worried about it. Apparently, you don't have to be that accurate with them. I don't know. Speaking of which, I'm supposed to be getting my flu shot and my COVID annual fairly soon. I think October 1st is roughly the target for the COVID and the flu I could have had. I expect I can have them together, but I'd really rather get the Hep B going so I don't miss it. But that might be my own kind of OCD or anxiety or something. So I kind of have those 3 different vaccinations to kind of see if I can fit in the schedule. So anyway, when I see the doctor, we basically do 18 trillion tests. He initially, Dr. Rubenstein, my GP, which I think I had said was September 1st. Yes, September 1st. He initially, kind of with the presentation of the symptom suite, was like, well, this is a bit of a puzzle because I can't see that unifying thing. And he did say start taking Zyrtec because maybe some of this is an allergy of some kind. So I started taking that immediately, which is cetirizine, like hydrochloride. I think it's once a day. I don't notice any side effects from it, but I've noticed 0 effect. So my guess, I'm still taking it, is he hasn't told me to stop, but my guess is that's not it, and it has nothing to do with it, and I'll be able to stop it. Okay. So, okay, Tuesday. Is that one? Let me see what this. That was just the other day. So September 5th, I went in to get my port flushed, which I don't know if you can see it, but it's right here. That's for the chemotherapy. That was my kind of, what's the word? I want to say pre-active, but forethinking kind of a, nobody's really tended to this in a while. I'm not having chemo. I don't have as far as I understand, a plan to start having it again, and yet the port remains, but I also know there's some hygiene involved that I can't do. So at one point I called and I said, can I just schedule this? And they allowed me to do it. So I went in to North Haven to do that. It's quick and easy. This is also the day I went in to do the Hep B vaccination, and I've written it here as a follow-up. So I think this was supposed to be my second vaccination, but I had just had the sick visit on the 1st, which is a Friday, and now on the 5th, I'm back in the office for the vaccination. And before she gave me the vaccination, I said, I just want to make sure you're up to date on my sick visit from a couple days ago, which we don't have an answer for, and I'm still symptomatic. And I don't know if getting the vaccination is recommended now, but I just want you to kind of read through and up to date yourself. So which she did, which is great. That was the RN Robin Schreck, and then she consulted Dr. Rubenstein, who came in to visit me, and we had more of a talk. He decided, let's just delay this, which, still haven't had. And as I said, we went in through, I gave a lot of blood. So we've done like blood cultures, urinalysis, stool samples, blood lab work, covering a massive range of, I thought maybe I had a tick-borne something or other, like babesiosis or however that's pronounced. He sent me in for a CT scan on September 8th. I had already been scheduled for a CT scan, I think at the end of September, something like that, which is what my oncologist wanted, so that she'd have an updated scan right before she saw me for this sort of normal follow-up. But anyway, I went in for the CT scan, which covered, I'm pretty sure it was chest, abdomen, pelvis. I'm pretty sure it covered the whole thing. So I went in and, did more blood draw stuff. And then on the 18th, which was 2 days ago, Monday, today's Wednesday, the 20th. So we're coming up to the end of this update. I went into Dr. Stein's office, and I had a very long visit, which maybe that makes it sound like I'm complaining, but I'm not, with a med student, somebody who's just about to graduate, actually. Jem Atilasoy is his name. Really, really wonderful, accommodating, insightful, educational patient, very present. And I think we probably spent 50 minutes, 55 minutes, something like that, just me going through every bit of my charting in terms of symptoms, much more detail than I just gave you guys. And he asked questions, and I followed up and back and forth. And, he said he was kind of stumped in terms of finding something unifying. And then Dr. Stein came in, and we talked over what's going on. And again, she didn't use any terms like cure or remission. She did say when she was talking about chemotherapy, I don't know if it was offhanded or considered or sort of a default phrasing, but she did say, something along the lines of when I get chemo again. Not if I get chemo again, but when. Now, maybe that wasn't the best phrasing and it doesn't really apply to me, but she did say it that way, which is the same way she said it last time I saw her. Is that a clue? I don't know. And I did say to her, look, I've had this ctDNA test 3 times. Each time it came back NED, no evidence of disease. And I am just presuming, this is just me thinking as a civilian, that if the time comes for the 4th test, because it happens on some schedule that's not obvious to me, the timing of it. It's like you have one, then you have one a month later, then you have one 6 weeks later, and then you have one 14 weeks later, something like that. So, it's not like every month you have it. I just don't remember. So I said to her, I'm just kind of expecting, since there's 3 negatives, I'm just expecting that when it comes time for the 4th, somebody is going to push back. Maybe the insurer, maybe one of the doctors, probably not the Natera, probably not the company that does the test. That's where they make their money. But I'm just kind of guessing somebody might push back a little bit, because why would we test you again? It's been negative 3 times. So I mentioned this to her, just sort of kind of what I was preparing for. And the reason I mention it is, like, I'd like to see if I can get you on my side here, if there's any pushback that you can push with me to have it done, because I'd rather have another test than not. And I thought, well, she might push back and say, actually, here's the science, and the blood draw is not 0 risk or something. And she actually just immediately was like, no, I have your back. I'm with you. That's what I think would happen. In fact, I don't see any reason why anybody would push back. That was her assessment there. So that felt nice that that's what's going on. This weekend I go to Free Training Day outside Philadelphia. So that will be a trip and a challenge for me to somehow make that happen. The real challenge that I have is kind of endurance. But I've been walking a lot most every day. I don't know what else I want to add. Thank you, Barely Bear. He's come to me with every appointment. In the last couple of weeks, during this kind of new suite of symptoms, and I've taken Barely Bear's picture and taken him with me, but it feels like it's just been so much so fast, including my regular everyday stuff, that I haven't posted those pictures. Usually the next day or that night I'll kind of post a picture of his journey with me, and I feel like I'm behind, and I don't know if I'll catch up, but I feel like I've gone in for a CT scan, a blood draw, and another blood draw, and a stool sample, and a urinalysis, and a doctor visit, and a follow-up for Hep B, and I just haven't done them all. So sorry if you're looking for those. Let's see if I can just call this up for you. I did want to just kind of point out how grateful I am that everybody's continued to follow the journey and offer advice and to be present and to donate. I have a number of people that just kind of send me a check every month, not as tuition, but just here to help. I'm not saying that to make you feel badly. If you haven't done that, it's not at all what I'm doing. So here is, how do I do this? So the GoFundMe link, perhaps you can just see there. So it's https://GoFund.me/9024 B as in boy, 907. So it's GoFundMe, basically /9024 B907. And perhaps you can see that on the screen right here, the third bit down. So I'll share that right now. And thank you all very much. Let's see where this takes us. And GoFundMe is definitely helped keep me alive and with shelter over my head. But we do feel like we're settling in. Thanks. Hey, we're back. As soon as I hit end, I thought of a couple of other things. Maybe Barely Bear reminded me. So when I last saw the GP Dr. Rubinstein, which, if I'm remembering, was about September 1st, but it was fairly recent, a couple of weeks. As I had continually done anytime I see any kind of doctor, it's like, can you look at my abdomen? I've had a major surgery. I don't know what it's supposed to look like or feel like or whatever. And so there's been this kind of sort of distension, sort of local distension at the site of the colostomy, which was reversed. And if you recall, that was never sort of sewn shut or glued shut or stapled shut. It was left to naturally close, which took, a while. I mean, and I remember now about 6 weeks or something where I just had to change the dressing every day and it was wet and kind of wait, which I'm not complaining about. Just, to me, wait is kind of a neutral term, but I know people hear it as a, point of stress. There's my foot. I adjusted my sitting a little bit as I started to upload the video, and now lost that comfort. So anyway, he said, oh yeah, like that he sort of described it as, well, that herniation, is the sort of thing that we might expect, and some people have it addressed, some people don't. Particularly if it's causing pain or if you have aesthetic issues. I think he said 3 different reasons. Maybe discomfort, I don't know. But I think he said 3, but I'm kind of not remembering them all. I don't think I have any particular issues around it. And he said, that's something for, a different doctor, but, let me know. And I didn't let him know. I was like, well, we're here for this current suite of symptoms. If you're feeling it and you're not like, oh my God, we have to, or I want you to start this prescription right away or anything. I just thought we'll just leave it be. But then like a couple days later, I got a call from Dr. Andrew Duffy's office in Guilford, saying, hey, we want to schedule you for the hernia consultation. So I just thought, oh, I guess I'm strapped into like another thing. And so that is November, what did we just say, 22nd, November 22nd. So I presume I'll learn a whole bunch more there, and maybe we schedule, I guess a hernia repair. I don't know, which my understanding is generally that's done arthroscopically and in a, like you don't stay overnight in a hospital. I don't know what you call that, like an office procedure kind of thing. I'm not quite sure, but that's on the horizon too. And also just kind of in terms of all the blood work and everything else, which I mentioned, almost everything has been negative. But there is a little bit of, out of range stuff in the CBC. I think the BUN creatinine, the platelets, and, they noticed like a slight vitamin B12 deficiency, and definitely an iron deficiency. I don't know how slight or not, but, so I started supplements for both of those, and, test and higher dose, micrograms, EBC. Yeah, and I guess hematocrit. And so I guess there's been sort of some concern there or something to address. I don't know if it's a clue about everything else or it's a sign that something's not quite right in the liver and all that. I don't know. But I did ask Dr. Stein specifically when I saw her like 2 days ago. I said, in terms of the things in the CBC that seemed out of range, I said, where are we in terms of the trends of those out of range things? And she seemed sort of content with it all. So I don't know exactly what that means, but I just have a daily thing where I take iron 3 times a day, vitamin B12 once a day, plus of course my multivitamin, and I take the Zyrtec, as I mentioned, the cetirizine, and I'm still taking the PPI twice a day from Dr. Corwin for the GERD. Is that it? Yeah, and okay, suspend any blood culture, stool. Yeah, so that next thing is scheduled for 11/22. So we'll find out what happens with that. Okay, sorry for an addendum to what was also a long video. Love.